was told that you may take about 3 or 4 minutes to get there, so you can set the time and let me know. So to ease your journey a little bit, I would like to draw your attention to the little drawstring bag that's in front of you. Check that out, and my wife and I stayed up last night filling these, and my house smells amazing right now. It contains a collection of intensely fragrant natural buds of fine French lavender. And when we're done here this morning, I would definitely love it if you would toss that into the glove box of your car, maybe the drawer in your office. It's gonna, linger there a while, and I think that's really neat. And in a month or so, you can I learned this, you can refresh the scent by just like squishing it, crushing the buds just a little bit in your fingertips. And I think this is just the coolest little thing. So you're pretty lucky, actually, that my name is Brian Lavender, because I am banking on you making a positive association with the pleasant lavender smell that you are experiencing and the good ideas that follow. Come to think of it, you are pretty lucky that my name is not Brian Schittler, or you would be holding a bag of something else. In truth, my wife was pretty sure that she was going to keep her maiden name when we married 31 years ago, but she married me, and she got the name Leanne Lavender. Yeah, her signature is awesome. And she liked the name so much, in fact, that she now runs a booming consulting business at leannelavender.com. No kidding, that's a true story. And she does love to tell people that my name is my very best feature. My company name, Lavender Lane Media, as it would suggest, I make beautiful and compelling video and photographs to convey story-based messages for external use, such as for marketing or brand building, or internal purposes such as community building, training, building culture. I think it's awesome. I guess you could say that I help people build meaningful associations from within and from without. So take yourself, for example. To the closest people in your life, you're a complex individual. Complex is a word that my wife has used to describe me. And to people in the outer circle, you maybe have a few key qualities that are memorable. And maybe you're a sincere listener, or you're a talented team leader, or you have a habit of just getting things done really right the first time, right? These are the things that are evident to people in your outer circle. And as a media-based storyteller, I am amazed at how well positive associations can magnify your brand values. In a recent project that I collaborated on with the Center for Workforce Development, and it was awesome. We zeroed in on the data-driven reasons that our region needs medical radiation technologists. And in fact, the film that is the outcome of that has been playing over and over, and we positioned Stacey strategically, so she's watched it about 1,000 times right now over breakfast. And it's been really cool. Our collaborative partners, that would be Quinte Health and Loyalist College, they supplied the voices to support the compassion and the skill that is sought to shore up these key healthcare positions in our community. It's the voices that really, really carry the day. In my work with the Small Business Office of Hastings County, the acumen of Christine McLean there has led to the creation of a trending video series that is breaking through to new entrepreneurs, communicating in essence that Hastings County is a vibrant place to associate with wildly successful startups. It's not the only vibrant place, mind you. It works for large concept organizations such as the Quinte Business Achievement Awards. It works for Aptex, which used to be called Global Med, and it works for smaller regional enterprises such as Mountain View Paving, such as Crushed Ice Productions, such as Nest Design and Contracting. Those are my guests here at the table today. It works for all kinds of folks. And for the not-for-profit work that I do and that I did during our 15 years in Africa and in Asia, and the work that I do for Rotary right now, storytelling is super, super central to the success of what we're doing there. The simplicity of building positive associations leads me to deeply embrace the media-based storytelling work that I get to do. Long before the camera is pointed and the big red button is pushed, there's an idea that is at the heart of the message, right? And perhaps later today, when you're deciding where to stash your bag of lavender, you'll catch yourself wondering what positive associations that people have with you and with your organization. Speaking of positive associations, it's my distinct pleasure to direct your attention to our esteemed guest speaker today, Stacey Daub. Passionate community builder, lifelong learner, and visionary health system leader. Stacey is the president and the CEO of Quinte Health. Quinte Health is a family of 4 community hospitals, a children's treatment center, and community mental health programs working together to provide high-quality, compassionate care to the communities they serve. Her career spans 3 decades with a wide range of leadership experiences in hospital, in home, community, and primary care, as well as across urban and rural communities in Ontario. Stacey believes in the importance of local health care, and it is people and community who fuel health and wellness in communities. Known for her collaborative leadership style, Stacey believes that her leadership impact is not best reflected by a list of achievements, but by the collective experiences and the outcomes of the people, the teams, the communities that she has served over time. Stacey joined Quinte Health following her time at North York General Hospital, where she was Vice President Strategy, Integration, and Digital Health. Prior to this, Stacey was the President and CEO of Headwaters Healthcare Center, a rural urban hospital where she helped to co-design the Hills of Headwaters Collaborative, a first-generation Ontario health team. Prior to that, Stacey was the CEO of the Toronto Central Community Care, Toronto Central Community Care Access Centre, recognized for its groundbreaking work in home and community care. Stacey has a master's degree from University of Waterloo, an MBA from the Richard Ivey School of Business, and has garnered provincial and national recognition, including Top 100 Women of Canada. Wow, yeah. "20 Faces of Change," National Award for Organizational Leadership in Diversity and Inclusion, and Minister's Medal for Quality Improvement. I suspect there's a few more, and we've shortened this list or you'd be here till lunch. Stacey has served on several boards and advisory committees, including the Ontario Hospital Association, the Change Foundation, Rotman School of Management, Health and Life Sciences, and the Creative Destructive Lab. Stacey was also appointed Honorary Colonel of the 24 Canadian Forces Health Services Centre at the Canadian Forces Base, located in Trenton, Ontario. I smile when I say that. I love Trenton. Stacey was born and raised in Kitchener-Waterloo and relocated with her family to the Quinte region, where she serves our community today as the President and CEO of Quinte Health. Won't you join me as we welcome Stacey Daub.
Good morning, everyone. Wow, I did not expect such a big turnout, and apparently I get to tell Ryan Williams that I may have beat him in terms of turnout. I'm not competitive, I'm just saying. I want to start off by a few ground rules. I want to know, anybody try those delicious tomatoes back there? I have a collection in my bag up here, so for the hecklers in the crowd, I got a good arm and you better be very careful. I also want to say that I heard some other people talking about other uses for the lavender. I heard, underwear drawer at the table beside me. And for all those pickleballers, I would suggest you put it in your gym bags because, there's a lot of sweat going on many nights in our communities. So thank you very much. I'm thrilled to be here. My goal today is just to tell you a little bit about how I got here today, a little bit about my journey, and then to talk about the journey of Quinte Health, and to talk about some of the, what I would say, the amazing accomplishments and opportunities in front of us, as well as some of the challenges. So, I know there was quite a background that people just went through, and as you heard before, to me, the list of accomplishments and the things that I've achieved are not near as important as the experiences people have had, whether it's a colleague, whether it's a friend, whether it's a community. And I think about all the communities that I've served in my history, and Brian made reference to the fact that I grew up in a smaller community and happened to make my way to Toronto for my first role. And in my first role, I happened to work at quite a small community agency and was rooted in the Jewish community. Had quite a profound impact on me in that most of the people I served during that time were survivors of the Holocaust at the time. And I got to bear to be the receiver of many, many stories at that time, stories that people didn't feel comfortable telling their own children, but I had the honor of hearing, and it taught me a lot about resiliency. When I was in university, I worked as a personal support worker, so I had a good experience as a frontline worker. During that time, I provided care for people, mostly quadriplegics and paraplegics. I was on call through university. I often got called in the middle of the night to come over when someone had fallen out of their bed. And I'd probably get fired now, would sit with them and have a Corona and have a good conversation about their life and what brought them to the places. And they taught me a lot at that time about the health system. It was just so controlling, and everything was organized around providers and not around the people that we served. It was during that time I really thought about a career in health. And early in my university, I met a gerontologist who, you know, that one or two people in your life who saw something special in you or thought you should, and he got me really to focus on gerontology, of all things. I was doing a health science degree and did a lot of research in that area. As you can see on my picture, I have two women up there. That is my mother and my mother-in-law. My mother's name was Mary, my mother-in-law's name was June. They both happened to be nurses, and they both told me that at that time in their career, or in their lives when they grew up, you only had three choices. You could become a secretary, you could become a teacher, or you become a nurse. And they both chose to be nurses. And funny enough, at that time, they both had to leave the profession as soon as they were pregnant. They were no longer capable of nursing when they were pregnant. So both of them returned to it later in life. I also happened to be a caregiver for a good part of my life. My dad, I provided palliative care for my dad for about 2 years while I worked at Headwaters. I would work at the hospital during the day, and I would do my overnight shift with him in the overnight, and I really came to understand how the system does and does not work for people. And I have the reason I left Headwaters was I had a 96-year-old mother-in-law who told us she was dying, and so I chose to take a step back and take a vice president role at North York. And she's 96 and coming up for Easter this weekend, so I don't know if it was a dirty trick to get me closer to home, but she's had quite an influence. My mother died when I was quite young, when I was 15, so she's played a big role in my life. I also have a couple of Indigenous leaders up on the board. One is Grandma Renee, and the other one is Joe Gallagher. And they have taught me in such a profound way how colonialism, and I think more importantly in healthcare, how Indigenous racism and bias still has a profound impact on the life and outcomes of many of our Indigenous neighbors. Recently one of my VPs was out in Tyadanaga and met a family who just recently got running water. This is 20 minutes away from us. So when people think this is somewhere else, it's not somewhere else. So why did I come to Quinte? Often people will ask me this question, and my husband and I, after many years of doing different roles, really I knew I wanted to go back to a community hospital. I felt like a community hospital was a place where I could make a big difference. And we were looking for the right community. When the Quinte role came up, it was, like everybody, the exact wrong time for me. I had not been at North York very long, but I went to the president of North York and I said, look, I have this opportunity I want to explore. I wouldn't have even explored it without him. And he said, I think you'd be really good for that community, so it's hard for me to say no to you. So I threw before I threw my hat in the ring, my family and I drove up to all I shouldn't say 4, 5, 6, 10 communities that I serve. And we went to each town and we walked the local streets. We peeked in the hospital windows because we weren't allowed to go in because it was the midst of the pandemic. And we were at a bookstore in Picton, and my 15-year-old looked at me and said, I think I could live here. And that sealed the deal that we would actually move as a family and come here. And he came to attended Centennial, had an amazing experience, and is now at Queen's. So I came here because I wanted to find a place where I could both professionally and personally make a difference, and where there was an organization that I felt had an alignment with my values. And during the interview process, some of my board members are here. I hate to say it wasn't the board that sealed the deal. It was a guy named Dr. Colin McPherson, the chief of staff of Quinte Health. I laser locked on him in the interview. I've never met a man who is so full of compassion and values, and I thought, boy, I want to work with that. I want to work with that guy. So that's a little bit about why I'm here. We moved our entire family here. I've lived here for 3 years. Often when I go back to my old neighborhood where I have many friends and neighbors, I lived there for 25 years. They ask me, do I miss it? And I tell them, I love coming to the city, I love seeing my neighbors, but I don't have 1 ounce of regret and feel very lucky to be where I am today. So, a little bit about leading through a pandemic and the Quinte discovery. You have to imagine that just before I got here, when I was at North York, the pandemic, that was in the spring of, can't remember, but the first year. And at that time, it was before vaccinations and the first generation of COVID, which is very different. Some people don't realize how different the first generation of COVID was. The alpha version, it was ripping through long-term care homes. And at North York, me and a group of colleagues drew a circle around our hospital because we knew the seniors in our community were going to be very vulnerable, and went out proactively, taught them infection practice control. We arrived at homes, people had scuba gear on, garbage bags, scuba, mostly personal support workers. They were terrified when they were coming to work every day. So we worked to help them. We brought teams of physicians. Physicians came out, nurses, and we taught them how to do infection practice and control. And in that group of 18 long-term care homes, we had barely any deaths. But right beside us was a long-term care home called Hawthorne Place. And many of you may remember this. It was one of the homes where the CAF came in to take over the Army. The Canadian Armed Forces came in to take over the home. They lost 60% of their residents in a 2-week period. 60% of the people who lived there died. Personal support workers told us people were dying every 20 minutes, and they came to me to take over the home after the Canadian Armed Forces had left to try and support them through that trauma. And like I said, when I arrived there, I just couldn't believe what had happened. I spoke to an older woman who was 92. All 3 of her roommates died in her room while she lay there with no help. So when people think back to the pandemic of the early day, you have to remember that first generation was quite destructive and deadly. It evolved a bit over time, obviously quite significantly. But that had a profound effect on me when I came here. I was terrified that the same thing was going to happen in this community. But thankfully the vaccines had rolled out before, and our long-term care homes and retirement homes did relatively well because the virus hadn't actually traveled here. Everything had been locked down, and by the time it did travel, most people were in relatively good shape. When I arrived, obviously, I had to wear a mask everywhere I went, so I made that button that you can see there with my face on it because I wanted people to see what I looked like. So I used to walk around with a button at the hospital, and I wish I made everybody at the hospital do that because I still meet people from the hospital, and I can't recognize them because they wore a mask. But a few things when I arrived at Quinte. One, perhaps like lots of jobs for people, I completely underestimated the complexity of these communities. I thought about Headwaters, which was a rural, urban environment set out of Orangeville, but it's nothing compared to here. Quinte Health covers 8,000 square kilometers. It is a long way from Picton, the hospital in Picton, up to North Hastings. Every community is completely different. Their ecosystems are different, and I think I was counting, I actually have to have a relationship with, 16 mayors. And that in of itself is a feat. Many councils, different levels of government. So just the complexity of the relational environment in terms of trying to get to know people across the region. I'm very proud that Quinte West is here today. I think that speaks volumes. When I arrived here, another thing I was really shocked about was how much, I don't know whether acrimony or relational issues there were amongst my foundations, the hospitals, the community, and in fact, actually, how many people hated Quinte Healthcare. I had never been somewhere where people had such anger, and I came to understand it. Anger comes from many places, and for many people, in particular some of the smaller communities, they had a lot of loss. At the time, the organizations were merged. They did lose services, and right after that came health system funding reform, which actually took about $25 million out of the health services in this region. So they lost services, and they saw what they feared would happen seemed to happen. And I think building back those relationships is one thing that I'm particularly proud of. I would like to be a bridge between Quinte West and Belleville and between those other communities, because we, you know, as Jim Harrison says, we are stronger together, and it's the collective, and you'll hear a little bit about that later. I was also extremely shocked about the lack of services in the community compared to many communities that I've been in, even rural communities. Mental health services, home care services, palliative care services. And that is for a whole host of reasons, but it's had an impact, and it's had quite a profound impact on the people who live in this community, but also the hospital itself. So I learned a lot in my first time here, and as you can imagine, we were still thick in the pandemic and essentially crisis managing. Many of those are in the emergency response business. You know, usually crises and emergency response centers are up for 24, 36 hours. This was years of having an emergency response team activating at high levels of stress and focus. I also came to a team that did really well during the pandemic, but as we went through and things continued to kind of cascade, they were tired and fatigued and looking for a brighter future. So that same year, we decided to launch, kind of reimagine the future of Quinte Healthcare. And you'll see at the top, we use kind of a bee analogy to do this work. So we started off with pollination sessions, and we created hives to have conversations. And I see Gary, I remember Gary being on almost every one of those as a board member of Quinte Health. But we engaged thousands of people to talk about the future of their hospitals. Not only did we do online work, we did surveys, and to get 600 to 700 surveys from this community tells me that it's a community who's very interested in the health and the future of their hospitals. We stood outside of Foodlands, Canadian Tires, just asked people about their local hospitals, what they thought. They're all, you know, so engaged and wanted to talk about how important they were. So we heard a lot from those groups and really felt a great sense of responsibility to take what they told us and to create it into a strategy and a vision for the organization. And I will tell you, and I think this speaks to the community that we serve, we heard a lot about humanity, compassion, community, and care close to home, as you can imagine, a place where everyone belongs. And so we moved from a mission and a vision statement to a purpose as an organization, a renewed purpose. And here's our renewed purpose that we rolled out a couple of years ago. I see Nadia, who has a similar purpose, and there's nothing better than having many people in a community who have a sense of shared purpose that can connect up to one another. And our shared purpose is creating healthier communities together. And this is a substantive departure from the past, which would have been, you know, excellent acute care services, you know, that are timely, efficient. This really is a new way of thinking about health and thinking about health as more than healthcare. For Quinte, we could spend every day trying to serve our community, and if we don't start to work with our community to think about the health and wellness of our population, we will never be successful. So there are some very significant shifts in this strategy. One is from being very hospital-centered to being community-centered. From being, this one might sound strange, but from being patient-centered to people-centered. And that's only because we need to care as much about the people who work at Quinte Health and the people who live in our communities as the patients that we actually serve. From going from, you know, silos to connections and interconnected ways of serving our community. So in addition to the kind of overarching purpose statement, we developed what we called aspirations. We didn't call them strategic goals. These are what we aspire to do. And the one thing, when people often ask me what I do, one of my jobs is to close the gap between what we say we do and what we actually do every day and every interaction. Because people have different experiences, and one of my roles with my team and with my board is to build the capability, to build the culture that is capable of delivering on these aspirations. So what are our aspirations? We want to provide the best care possible for this community, the communities we serve. These communities deserve nothing less. And in fact, you'll hear later that we provide better services than some of the state-of-the-art centers of excellence in Toronto, and I'll highlight some of those. And in that care, the best care possible, we want to think about this in a way that's nothing about them without them. So nothing about the way we deliver care without the patients and caregivers, nothing about the way we do our work without the people who do the work, and nothing about our hospitals and our programs without our community having a say in that future. We are also, one of the things a lot of people talked about is they're afraid of losing humanity and compassion. I think the pandemic was hard on a lot of people. All kinds of people have responded in different ways, and within the hospital community and with the people, they don't want to lose that sense of compassion and connectedness and why people actually went to healthcare in the first place, which was to help people and to make those human connections. And it is sometimes difficult when you do this job day in, day out. I know a lot of people have been talking about the opioid crisis, but for our staff every day, every person who comes in to see that person as a human being with a family and a father and a mother and a grandmother, you have to work pretty hard at that, especially given some of the circumstances. So compassion and keeping that at the heart of everything we do is important. Connection, so this idea, it's connection within our teams, connections across our hospitals, connections with our community partners, with our municipalities, and we call it connection, you could call it partnership, and then the last, a real big focus on our people and thinking about them, and I'm particularly proud of some of the work that we've done in that area. We also did something, somewhat like a marriage renewal or vow renewal. We did a value renewal. So we went out to talk to people to say, do we actually live these values, or do we need to make some adjustments and change? The one that came back the strongest from everybody at Quinte Health is the idea of imagine it's you. So this is the idea that, if you're a registration clerk at the emergency department, it might be the 10,000th time that you've actually registered someone for an emerge visit, but for that person, it's their first, and people are often scared and they're not sure what to expect, and how do we do that? And with our teams, we've also talked a lot about this value. It's not about just with our patients, it's also about colleagues. In North Hastings, the roles up there are completely different because it's a much smaller hospital, and sometimes in Belleville, they don't understand North Hastings, and North Hastings doesn't understand Belleville, and how can they imagine what it's like to work in these other environments? And similarly, what's it like to be some of our community partners? What's it like to be Bridge Street Church? What's it like to be Loyalist? What's it like to be the police service, the fire service? And how can we understand and appreciate their roles in a different way so that we can find common purpose and connectivity to work together? So words matter, and I'm sure a lot of you wondered why Quinte Healthcare changed its name. And sometimes I get the smirky comments like, "Why'd you take the care out of Quinte Healthcare?" That's the best. So if you just saw the strategy, I think we are actually trying to really invigorate and bring care and humanity to the fold. But there's a couple things about it. One, we're not an acronym, and I go around, people talk about QHC. Usually not in positive terms. For recruitment, people don't know what a QHC is, so we were reduced to an acronym. The other thing is we were called Quinte Healthcare Corporation. We're not a corporation. Yes, we are officially, but we don't need that in our name. We're in the business of people and humanity and compassion. We're not a corporation. Even though we have good business practices and all the prerequisites, we're not a corporation. So we changed to Quinte Health, and Quinte Health was very specific. It was intended to denote that health is more than healthcare, that we care not only about the health of our patients, the health of the populations we serve, the health of the people that work at Quinte. So to me, it is a very powerful name, and we are standing behind it. The other thing that's interesting, and many don't see it, this is quite a clever branding, the hospital symbol is in the middle, and those four are really the four hospitals of Quinte. And the reason, even though we have other parts of Quinte, those hospitals have been fiercely independent. And I understand why, because they are centered in their communities. But very early on in this process, I started to ask people, could you be really proud to work at Trenton Memorial Hospital, but also be really proud to work at Quinte Health? Could you imagine that being possible? People were like, oh, maybe. This was very early on in the strategy. And I think 6 months after the strategy was launched, I had a pharmacy technician called me from North Hastings, and she said, I just want to let you know I'm proud to work for North Hastings Hospital. I'm really proud to be part of Quinte Health. And I think that gives you a sense of the growing pride. We also, we don't have a lot of money for swag like a private business, but sometimes we get donations, and we have t-shirts and hoodies and things we give away for to come in and be leaders in our organizations, to sit at tables, to make decisions, and to influence the way that we grow and deliver our programs. Our health experience program is really growing. Lorena Quinn is a newest health experience partner in our diabetes program, and I'm very thankful for that. And only the people who have lived experiences, yes, our teams have lived experiences in providing the services, but they don't often have lived experiences with cancer, or having diabetes. So bringing in those individuals to help lead, and I'm not talking about advise or inform, I'm talking about in there to make decisions and helping to influence the way that we operate our program. So very excited about that. So if we're going to care for our community, we have to care for the people who care for our community. And this is just a little smattering of Team Quinte from across our region. I know these are a lot of pictures of me on the bottom, and I apologize for that. But I do want to introduce you to Rachel, Anita, Amy, Heather, and Molly. These are all people who work in different roles. Rachel works at our Domestic Violence and Sexual Assault Center at Quinte. Anita is a hospitality worker who is the person who gets in there when someone leaves their room and turns over that room so quickly so that we get the next person out of the emerg. Amy is a pharmacist, so she looks at all your medications and makes sure that they're safe and that you're on the right medications. Heather is a volunteer who greets you in the emergency department and tries to make you feel more comfortable. And Molly is an amazing occupational therapist at the Children's Treatment Center. And we've been going out doing these, we all make a difference, to understand different roles around Quinte and highlight them and talk about them, and it gives me a great opportunity to meet people. A few things about staff. We have hired 444 new team members to Quinte Health this year. 444. That is all frontline staff. In addition to that, we have hired, I'm just looking at the number, 62 either new locum or associate physicians to the organization. So when people think, you hear all the time that healthcare is difficult, we're recruiting. We're actually getting a lot of people. And I want to point out Mark here from Loyalist. One of the most fantastic partnerships we have is with Loyalist College. This video is a great example of that partnership. We went to Mark and said, we're worried about diagnostic imaging, and they created a program, and it's already full for the fall. It's one of the only in Ontario, so not only is it going to give a pathway for local people here to have meaningful jobs, it's going to bring people from elsewhere. This year is the first year that the repatriated Loyalist RN program, it used to be half in Brock and half here. Last year, when the graduating class was through the Brock model, we had 4 people come and do student placements with us, and we hired 3. And this year, with the program being repatriated here, we had 27 students from Loyalist, and we're hiring 25 of them. So it gives you a sense of how powerful that model of developing and locally growing talent. We're doing a lot of work around stabilizing our teams and trying to provide better orientation support, wellness, health, and we still have a long way to go. And the other thing people want to do is they want to grow their careers. So we're really focusing this year on how to grow their careers, and a great example is PSWs who want to become RPNs and RPNs who want to become nurses, and Loyalist is a big support to that. Caring and connection, just want to give you a sense that our volunteers provide something like 10,000 hours of support to our hospitals. So they man the kitchens, they have cafes, they offer many of the new to you and secondhand stores, including the one in Belleville. And you think that this is just about giving, but for many of them, I talk to them all the time. Someone will tell me, my husband died last year. I started working at the hospital as a volunteer, and I have this whole new set of friends and colleagues. So volunteering is more than giving back to your community. It's also got a lot of to give back to you and create a sense of community for you. Partnering to care for our community. So a couple of partnerships, these aren't all the partnerships that we have, but a couple I want to mention. One is Health Pulse. So this is a partnership between the municipalities, so Quinte West, Belleville, Prince Edward County, Hastings County, Loyalist, and Quinte Health, to come together to think about the health of our population and to start to work in partnership as leaders. And we're no different. Not only is it enabling us to do new and different things together, but it's given us a network and a sense of camaraderie to actually work together to understand some of the challenges we're facing and working on them together. With the Center for Healthy Communities and Nadia and the great research grant, we're really looking forward to finding all those synergies to really work on this. We have a new partnership with the Center of Addiction and Mental Health. We are the 988, the national suicide line provider for this area. We've already received 1,200 calls since just December. And why Quinte? We're the only organization from Scarborough to Ottawa to offer this service, actually even Ottawa. We were selected, I think, because of the caliber of the staff and the teams that exist at Quinte. So we provide crisis support. And the great thing about this model is that it works in such a way that spillover calls can go to other regions. So there's never a call that's not answered. It's right across Canada. And it's not just for people who are contemplating suicide. It's also for people who are struggling with mental health or whose family members. They do a really good job. So I would highly support, if you know anybody who needs to use that line, to encourage them. We do a lot with the base in terms of mock training, and we also did a large natural disaster. So if any of you worry, if something blew up in the region, we do a lot of mock sessions to make sure that we as fire, police, hospital, all are ready and prepared for those. We are also partnering with our community. I can't go without saying to think about the opioid crisis that is affecting every community across Ontario. I am very proud that Lisa Alley and Brandy Hodge stepped up to chair this group. We have a lot to do, but we need a plan. And that's the work that's underway this week. We can't just wish it away. It's not going to go away, so we need a plan. And we've been working now for the last 3 weeks to develop a very comprehensive plan that I'm hoping every single person and leader in this community can stand behind and scream from the rooftops for funding to make sure that our community is well supported. Colin has a big role in this because really understands his population well and has been a real leader. So, health is more than healthcare, and this just goes to show you that when you think about healthcare right here, healthcare impacts about 25% of your health. But if you go up, the majority of things that impact your health are things like your income, your early childhood development, your attachment with your parents, your disability, education, income. And so if we really are going to think about health and wellness of our community, we are really going to have to start to tackle these in collaboration with our community. When I got here, I couldn't figure out why there was so much demand for the Quinte services. Like the emergency departments, I've never seen anything like it in terms of per capita. So we did a simple study. And all this study was to take 4 basic risk factors. So education, whether you lived alone or with someone, your income, your ethnicity, and whether you lived in an rural or a or an urban environment. And this here shows you the patterns of social determinants of health and healthcare use. So on the left side is the lowest risk groups for ED use, and on the right, the red is the use of the ED for the highest risk groups, and the same for mental health. So for our region, we did a bit of a study, and what we determined is that for our region, we have 71% of our communities in the high-risk groups compared to Ontario that has 16% in these high-risk groups. So now I understand why we have such demand. And this is just an illustration. We get 1.5 times the number of visits per 100,000 emergency department visits compared to other. That's 40,000 more visits than would be expected of a community in our community. And if you take into account the social determinants of health, it goes right back to the average. So we have work to do. We can work harder and harder and harder, like a gerbil on a wheel, in the hospital, or we can partner in our community to think about how to stop this kind of conveyor belt into the hospital. Mental health is also health. I often talk about loneliness, and I know I've talked before that there's a couple of countries, Japan, the UK, they have ministers of loneliness. Because it's become such a, what they call a pandemic, a modern pandemic. They say loneliness is the equivalent to smoking a pack of cigarettes a day. It has a huge impact on dementia, on the risk of heart disease, on the risk of stroke. So why do people play pickleball? Yes, they're trying to get in shape and they're, well, they go because it's a community and a sense of people to connect with and laugh with and have a shared experience. I don't think it's just, and it's a low barrier, easy sport to get into. So that's why people play pickleball, because they're looking for social connection and meaningful social connection, and it creates an immediate don't have to really love the person. You can play with them for a while, and eventually maybe you'll love them, maybe you won't, like Dave O'Neill. You know, it depends on the person.
I love you.
The other thing that Quinte Health is going to be facing is what I call, and what many people are calling, the silver tsunami. I think that's a little bit of an unfortunate picture up there, all those old people coming in on a wave, but it is very true. And our community is already where Ontario is terrified of being in 20 years. So we have an older community. And that just doesn't impact the demand for a hospital, it impacts the number of healthcare workers. You know, if you have an aging community, you have less people who are of working age. It impacts the economics of a city and town. So we have to work at this with our municipalities and with others. The other thing is the healthcare system is perfectly not designed to meet this group of people coming through. Our healthcare system was designed for, you know, traumas, infectious diseases, not for people who have multiple comorbidities. You know, you often hear a story of sometimes going to primary care and say, you know, we can only talk to you about one thing today, you know, when someone has multiple chronic illnesses. So we have a long way to go to rethink the system. You know, I would love to see geriatric clinics outside the hospital. So I give this story. My dad, years ago, he had what he called a waterworks problem when he couldn't go to the water, couldn't pee. The last thing that was good for him is to drive down to a hospital and sit for 4 to 6 hours to have that treated. Why not a geriatric clinic where you could actually get it treated in a much different way? And I want to say hospitals are not bad. You know, when you come into the Emerge and some people are frustrated, like, why didn't they deal with all? They're not designed to do that. They are designed to actually help treat the presenting issue and then have you go somewhere else. And that's important because you could have a stroke, you could have a cardiac condition coming behind. But because we have such a lack of primary care and other services in our community, people are coming to the hospital to get prescription renewals. You know, basic things around their health, even referrals to get a hip replacement. If you don't have a physician, how do you actually get a referral for a hip replacement or a knee replacement? So we are playing a very big substitution role that we are ill-equipped to do, but we're doing our best. So, just connecting us back to purpose, aspirations, and values. Our goal is to continue to build these aspirations, get closer to these aspirations to make them a reality. And it really is the interrelationship between our purpose, our aspirations, and our values, I think, that have really taken off. In Quinte, I feel it every day I'm there. I can feel people living their values. I can feel people leading these aspirations and really thinking differently. You know, managers thinking outside their programs, outside the hospital. So it's beautiful to actually watch. And, you know, someone told me the other day, the energy just feels different. And again, I have Jeffy, who's one of our managers here. He's got the toughest job. Toughest job. Anybody there should give him a hug before you go. They're tough roles. And so we need to keep hope and optimism and keep building a better, stronger future. And we are way stronger than we were a year ago, and I'm certainly clear we're going to be way stronger in a year from now. So, creating a healthier community starts with you. It starts with you taking care of yourself. You know, we talk about opioids, but I'll tell you, alcohol is a much bigger issue, has way more of an impact on hospitals and health in our country than opioids on any day. But we don't talk about alcohol. We just, you know, have all the beautiful LCBO commercials to talk about how wonderful it is, but it actually is killing a lot of people in the ways that it's being used in our communities, especially through COVID. I think it was a large coping mechanism for many. You can become a health experience partner. You can donate to your local hospital or any other community agencies are here. You can get involved. You can start a pickleball league. You can start a book club. There are so many different ways that individuals can actually make a difference at whatever level. But quite honestly, it starts with you. If you don't take care of yourself, your own mental health, your own spiritual health, your own physical health, as someone said to me, you know, if you don't put your own oxygen mask on first, it's not very likely that you'll be able to help anybody else. Lastly, I just want to give a big thank you. So there are so many people who support our hospitals, everything from private businesses to foundations to clubs, you name it. The level of support we've seen from all corners. You know, Bancroft's such a great example. We couldn't get funding for a CT scanner, which is the standard of care. People are driving 2 hours to get a CT scan, or some people just don't get a CT scan because they're not willing to leave their community. So they're willing to just let something go. That community said, you know what? too bad for that. We can't get funding. We're going to do it ourselves. And yes, they did. They raised $3.9 million in Bancroft over a period of 6 months, and that CT scanner went live. We now have people getting CT scans in that community in an amazing way that nobody ever imagined possible. So your hospitals and your community services are only as strong as the people behind you. I will tell you, nobody cares about this community like you do. Nobody. Queen's Park doesn't, the Premier doesn't, Prime Minister doesn't. It comes from community, strength comes from community, so we need to really work on it. I want to thank my board, many members who are here today, the foundations who support us, every single staff member at Quinte Health has supported me through my journey. Health Services 24, who's been so kind and gentle with me as I've tried to figure out how to put that uniform on properly. I need a whole tutorial in the bathroom before I come out and present myself to anybody. And then I think just for every single kind and generous person that I have met in this community who has been a source of help and support for me. My job is challenging on the best of days, and to have someone to laugh with in the evening and to not talk about work for a few hours is such a gift. So I feel incredibly privileged and very happy to be here. Lastly, everybody, if you wouldn't mind taking a moment on Monday, it's the Air Force's 100th anniversary. We have the honorary colonel of the base at the back, Julie Lang. Take a moment to maybe put a blue light somewhere in your house. That's the blue light campaign. We're going to be flashing up blue lights on all of our hospitals on Monday and Tuesday. And I must say I was ignorant, really ignorant about the Canadian Armed Forces. And it's been quite a humbling experience for me to meet the men and women who give so much and sacrifice for their families and others. And so we being right next door to them, I think it takes us all a moment to be thankful. And with that, I'll pass it back and see if there's any questions.
No, I want to thank you so much for coming here and joining us today. I know that I usually promise that we're going to be out of here at 8:45, but I think it was worth the extra 10 minutes to hear everything that Stacey had to say. I will let her take the stage for a second for some questions if you want to stay after, but we'll get through some announcements here really quickly if you don't mind. Yes, and I just want to, connecting